What are your personal risk factors for TB transmission? Imagine being in a room where someone with active tuberculosis is coughing or speaking. Tiny droplets containing bacteria are released into the air, and if you breathe them in, you could become infected. Your risk of catching tuberculosis depends on how often you're exposed to these infectious droplets and how your body responds afterward. If you spend a lot of time near someone with active tuberculosis in close contact, especially over long periods, your chances of exposure increase. This is common among family members, friends, coworkers, or classmates who share living or working spaces. Traveling to or living in countries where tuberculosis is widespread also raises your risk. Countries in Asia, Africa, and Latin America have higher rates of tuberculosis, so frequent visits or long-term stays can increase exposure chances. Living or working in crowded environments such as homeless shelters, prisons, long-term care facilities, or jails makes it easier for bacteria to spread because of close quarters and limited ventilation. Your personal health also plays a big role. If your immune system is weakened by conditions like HIV infection, diabetes, cancer, or if you are taking medications that suppress immunity, your risk of developing active tuberculosis after infection is higher. Recent infection with tuberculosis bacteria, especially within the last 2 years, also increases the chance of disease progression. Other health issues like malnutrition, lung diseases from silica dust, kidney problems, or a history of stomach surgery can make you more vulnerable. Lifestyle choices matter too. Smoking, vaping, alcohol use disorder, and substance abuse can impair your immune defenses. Very young children under 5 and older adults are more susceptible because their immune systems may not respond as effectively. Being underweight, with less than 90% of your ideal body weight, can also increase your risk. Social and economic factors influence exposure and health. Poverty, overcrowded living conditions, poor nutrition, and limited access to health care make it easier for tuberculosis to spread and for infected individuals to go untreated. It's important to remember that people with latent tuberculosis infection carry the bacteria but do not show symptoms and cannot transmit the disease. However, if their immune system weakens, latent infection can turn into active, contagious tuberculosis. Knowing your personal risk factors helps in making informed decisions about screening and prevention. If you think you might be at higher risk, talking to a healthcare professional about testing for latent tuberculosis infection and possible treatment is a good step. Always seek personalized advice and follow medical guidance to stay safe and healthy.